Good morning, everybody. Firstly, can I thank the more than 23,000 people that were tested overnight in New South Wales. And again, of course, we've had no community transmission. And I just want to thank the people of our state for really responding to our requests for more testing, but also for following the health advice, because no matter what stage of the pandemic we're in, we need to make sure we hand sanitise, maintain the social distancing and get tested if we have the mildest of symptoms. I'm very pleased to say that given the vaccine has arrived in Australia and is being safely housed in Sydney, that from Monday, over the next 3 weeks, 35,000 frontline workers will be vaccinated in New South Wales. And I'm very pleased today to be joined by Brad, who's a nurse manager, by Lachlan, who's a police officer, and by Gaia, who's an environmental services manager. These three outstanding individuals are part of the online or the frontline fight in the quarantine system. We have thousands of people who work in quarantine. It includes, of course, the frontline health workers such as Brad. It includes our police officers such as Lachlan and, of course, our environmental services people, our cleaners such as Gaia. And we're pleased that all three of them are here today because they will be representing the cohort of individuals who will start getting the vaccine from Monday. It will be delivered for the next 3 weeks out of our 3 hubs in Sydney, which is Westmead, Liverpool and RPA, Royal Prince Alfred, and those 3 venues are where the first cohort, the first 35,000 people will be vaccinated. So this is the first cohort that will be taking place over the next 3 weeks. And of course, we'll update the community on who will be in line for getting the vaccine beyond that 3 weeks. For the first 3 weeks, it is the Pfizer vaccine. So obviously, everybody who gets the jab will need a repeat jab in 3 weeks' time after the first one. But that process will definitely start in New South Wales on Monday. Now, this is a very important development in our fight against COVID. It does mean that we start a new phase. The vaccine rollout does mean a new phase. And whilst the scale is not large to begin with, given the comments from the federal government in the last few days, we anticipate the scale of our receipt of the vaccine will increase over the next few weeks, and we'll keep updating the public as soon as we have the information on who will be next in line and when that will take place. But in the first 3 weeks, in addition to all of our quarantine workers, those health workers who are highly exposed will also be getting the vaccine. So, for example, people who are taking the tests at the clinics, emergency department workers, ambulance officers, people who are on the front line who may or are exposed to the virus on a daily basis will also be getting the vaccine in that first 3 weeks. So the cohort of 35,000 will include all those essential health workers in and around our quarantine system, and also those in and around our testing clinics, our emergency departments and ambulance officers as well. This is a pleasing development, but I do want to stress, and Dr. Chant will stress this as well, that it does not mean any of the restrictions, any of the rules we have in place in managing our quarantine system can change at all. If anything, we have to be even more vigilant in welcoming back 3,000 Australians every week, amongst obviously the new strains of the virus as well. So it's more important than ever before that everybody working in the system, everybody in contact with the community, anybody who has the mildest of symptoms has to keep getting tested. So just because the vaccine rollout has started does not mean we can relax. It doesn't even mean you can relax if you've had the vaccine, because it's really important for all of us to maintain the rules, to maintain the settings and to follow the health advice to make sure we're able to get through the next few weeks and months. Now, of course, we'll have more to say about what the settings will look like in the course of the next few months, depending on the vaccine rollout and the take-up, but their conversations we'll continue to have with the community on an ongoing basis. But the good news is that from Monday, we'll be rolling out to 35,000 workers, mainly quarantine and frontline health workers, within the next 3 weeks. But we'll also have something to say in the next week or so on what happens after the first 3 weeks. But as you know, the New South Wales Government will convey information to the community as soon as we've locked everything in, as soon as we know for certain what's happening beyond the next 3 weeks. So I want to thank everybody involved in the process, and especially to Brad, to Lachlan and to Gaia and all the thousands of people who've helped keep our borders safe, who've helped keep the community safe. I mean, these 3 individuals are part of the thousands who've literally gone into a situation where they know COVID exists. They've gone into a situation where they've been exposed, and yet they do it pleasingly on a daily basis. And if any of them want to say a few words. during or after, I'll obviously let them do that. Now I'm going to ask Dr. Chant to provide some information on the medical aspects of the virus and the administration of it, and then Minister Hazzard will also say a few words.
So New South Wales recorded no new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. There were 4 new cases were acquired overseas, bringing the total number of COVID cases in New South Wales since the beginning to 4,954. Pleasingly, there were 23,463 tests. And can I thank the cooperation of returning Victorians and New Zealanders who have also been monitoring the websites for particular public health action. As you're aware, there's been a number of risk exposure venues that have been put up on those sites. We are watching the situation in Victoria, and they may well have already announced their process, so it's likely that the stay-at-home order is due to expire today, and that will just expire. So can I thank everyone for their cooperation and their willingness to come forward and get tested. It certainly has played a significant contribution in keeping us safe. I now might want to just touch on the process with the vaccination. So clearly the priority for us, and this has been reinforced by the Australian Technical Advisory Group on Immunisation, is that we need to protect our workers that come into contact day in, day out with the greatest risk of COVID. And that really is our border and quarantine workers. And then also the next tier would be workers in health that may be required to treat returning international travellers, or those that would be taking swabs and performing tests on those travellers. So that is the process. So at the moment, we've got the 3 hubs, and we have a list of people that are working in our quarantine system. So we have been establishing that daily surveillance testing, and that forms the basis of the lists which are generated, and we will then be calling those individuals today for booked appointments in the next week. The process is they will be given a consent form to review and a consent form to sign. They will also be given the opportunity to answer questions, and there will, if there's any particular underlying medical conditions or other circumstances where they need to have a more thorough assessment, that can then be arranged. But there will also be clinical staff, nurse immunisers, and in the beginning of the program, medical staff there as well to answer any of the questions that they might have. And it is important that we do informed consent well, and people really understand the vaccine and what to expect. The vaccine is associated with some side effects, as we do with all vaccines, and that's clearly laid out in the information material. But what that means is also we just can't vaccinate all of the quarantine workers on one day, because if everyone gets a sore arm and feels unwell the next day, that can have operational impacts. So there's obviously some clear processes that we need to go through in making sure that people are phased and that we're not vaccinating a one workforce all at the one time. And that will also mean that we have to take that care when we're also vaccinating healthcare workers who might be performing the tests, the COVID tests on patients, again, not to take out our whole workforce. And so those are some of the organisational issues that will underpin it, and that's why you will see a graduated list of both quarantine workers, border workers, and also health workers in the mix to allow us to get to that number in those first 3 weeks of the program. Also at that time, we understand that the Commonwealth will be vaccinating in aged care facilities through contracted arrangements, and obviously we're working closely with the Commonwealth to tease out the next phases of the program. But what we wanted to identify today is what is on the table for the next 3 weeks of the program.
I just want to emphasise this, that obviously we've got Lachlan, Brad and Guy here, and they are representative of the incredible workforce. We've had about 6,500 staff are needed every week to keep our hotel quarantine system operating. So to have these staff now accessing the Pfizer vaccine is a giant step forward for us in our management of COVID. Critical area of vulnerability is obviously the hotel quarantine system. It's the best system, but it also has vulnerabilities, as has been seen in various states and, of course, most recently in New Zealand. I also just want to say to the broader population, the next few weeks the focus is on our quarantine workers and Pfizer. Please be patient. For the rest of us, in the months to come, the weeks and months to come, the federal government will be releasing more information about the AstraZeneca vaccine, which most of us will have access to through a variety of sources, probably our GPs and other arrangements, but that's not for us now. Don't be fearful that you won't get your turn of the vaccine, but the next 3 weeks is about quarantine workers. The weeks after that, we will see AstraZeneca being made available more broadly through the normal processes where you would, as a patient, normally go and get your vaccine. So just for the time being, be patient and allow our frontline staff to get their vaccines. Thank you.
So over the 3 weeks, we're expecting to deploy all of our vaccine that's provided to us. So as per our articulation, we're going to be vaccinating around 35,000 staff during that period of time. The other thing to know is that the vaccine dose will be 5. We will be getting out of each vial at the moment, whilst there is possibilities of getting 6 doses out of the vials. That's really contingent on us having access to low dead space volumes, needles and syringes, and they won't be available till later in the year. So our estimated dosage, we're planning to get about 5 doses out of each of the vials.